patients with peripheral arterial disease have a high risk.
The majority of patients with PAD can actually be enrolled into the study. So hi, thanks for joining us. My name is Sarah Jane Messiter. I'm a vascular registrar based in the East Midlands, and I'm also an associate surgical specialty lead for the Royal College of Surgeons of England. So today we're talking about all things colchicine and also peripheral artery disease. We've got the Chief Investigator, Rob Hinchliffe, who's here.
Yeah, I'm Rob Hinchliffe. I'm Professor of Vascular Surgery at the University of Bristol.
Perfect. So, okay, colchicine, for me as a trainee, that's not something I automatically think of with PAD. Where did that idea spark from?
So I think most of us are now aware that patients with peripheral arterial disease have a high risk of cardiovascular events and limb events. And traditionally, we've managed that through a standard risk factor management. So that being lipid management, metabolic management, so hypertension control, antithrombotic and increasingly anticoagulation strategies in combination. But there's a realization that atherosclerosis is an inflammatory disease. And there was a landmark study called the CANTOS trial some years ago, which was the first to use a specific agent to target the interleukin inflammatory pathway. And that demonstrated a reduction in a small number of patients, a reduction in the number of cardiovascular events. But unfortunately, it was associated with a high risk of adverse events. But it did really spark the enthusiasm that actually by modifying inflammation, we might actually reduce the number of cardiovascular events. As it happens, colchicine, a commonly used drug for gout and familial Mediterranean fever, is a medication which also inhibits very similar pathways, particularly on interleukin-1 beta. And therefore, the hypothesis was that actually we might be able to modify the inflammation and reduce the number of cardiovascular events. And there have been a number of trials in cardiovascular disease, particularly with atrial fibrillation, with acute MI and chronic coronary artery disease, that have shown promise that actually we may then be able to mimic this situation in the peripheral arterial disease space.
Amazing. Okay, so LeaderPAD, how many sites and things are you thinking of?
Well, we're funded by the British Heart Foundation as part of the Global Cardiovascular Research Funders Forum. And that's great because we have an international collaboration with a number of countries, so the Netherlands, North America, Australia, South American countries, to deliver a trial which has a true international flavour to it. We are performing the UK arm of the trial and plan to recruit 1,500 patients. And we already have 20 sites that have committed to deliver the trial. So hopefully it will be of interest to people and surgeons and patients who I think will recognise this need to address the excess risk associated, excess cardiovascular risk associated with PAD.
Absolutely. And so what's the intervention? What are you doing?
So it's low dose colchicine. There's a run-in period in which patients are evaluated to see whether they can tolerate colchicine. Actually, colchicine is pretty well tolerated because it's been around for many, many years. And then patients are randomized to either a placebo or colchicine and then followed. And it's because it's potentially repurposing of a very established drug. It's quite a light touch for any CTIMP trial. And we follow patients out to 4 years.
What is it you're looking for at 4 years?
We've hypothesized, or we're powered to detect a 25% reduction in cardiovascular and major adverse limb events at that period of time.
You talked about kind of you giving people low dose colchicine. Is there a worry about how that might react with other drugs? Is there things?
Colchicine is generally very well established as a drug. It's been around a long time with a very good safety profile. Around 10% of patients will have some adverse gastrointestinal symptoms, diarrhea, a bit of bloating. But actually, if you look at some of the big cardiovascular trials which have evaluated colchicine, the placebo arm has something in the region of 7% adverse event rates, and the colchicine has 10% adverse event rate. So ultimately, yes, there is some gastrointestinal side effects in patients. With some adjustment of dose, we can usually have pretty good tolerability. In terms of interactions with other drugs, again, colchicine is a pretty benign drug, but there are interactions with some drugs, such as some of the HIV protease inhibitors, things like azithromycin, erythromycin. But otherwise, it's very well tolerated down to low levels of GFR, down to GFR of 30. It's still licensed for use.
So ideally, actually, the majority of patients with PAD can actually be enrolled into the study.
Yeah, and I think that's the advantage of this study, is that there's a broad inclusion criteria, very few exclusions, and hopefully it will be a study that will be relatively straightforward to recruit to.
Yeah. And what about co-enrollment? Because that's always the worry.
Yeah, we are open and patients are eligible for co-enrollment in RCTs. I think historically, as a sort of research community, we always stuck to one RCT, one patient, one RCT, but now there's a recognition that there are opportunities, and we're certainly open to that. I think the difficulty here is just the potential additional burden on visits for patients, and so I think that has to be addressed on a sort of case-by-case basis.
Fair enough. And how do we find out more?
Yeah, there's a LeaderPAD website. You can contact me directly. I'm sure you'll provide a link, and we will be very open to have a discussion about opening sites and for any further information.
Fantastic. Well, great. Well, we wish you the best, and we really hope that you manage to get it up and going well with good recruitment numbers as well. Is there anything else you want to say?
No, just to thank you for everyone who's already started to enrol patients and engage in the study. It's always really incredibly helpful, hopefully for the benefit of patients.
Absolutely. Yeah, absolutely. So we've heard from Rob Hinchliffe. He's come along and spoken to us about LeaderPAD. And that's what this session's been about. If you're interested in finding out more about the other trials we've got on board or the other information that we have about research, then please do join us on the Vascular Research UK website. See you there. Thank you.